Welcome back to Third Wheel Week. Gary Lumpkin sitting in with us. We're happy to have Des here, KS95, while Elizabeth's off getting that LASIK eye surgery. Now, Gary,
me and the boys.
It's the boys. Always me and the ladies, but it's you and the boys this time. Now, you've done a lot of stunts. Would you ever do LASIK eye surgery on live television?
Yeah, like I said, I've got a set of fingernail clippers here. I'm sure with some duct tape and some hand sanitizer, we could have made it work.
Doesn't seem like a good way to go about it. Well, just a few minutes ago, you saw it live right here on Twin Cities Live. The vision in one of Elizabeth's eyes went from blurry to clear during her LASIK eye surgery. And during the break, her second eye went under the laser as well. And now it's time to check in with our patient, see how she's doing. Emily, you're there with our patient.
I know, she's looking great. She looks great, and I've been asking her the whole time, are you okay? Anything I can do for you? But Elizabeth, how are you feeling?
I feel good. I mean, it was a little nerve-wracking while it was happening, but I felt it went so fast.
And what are you seeing now?
It's a little, everything's just a little blurry. So, and Dr. Lobanoff said that's normal, that it's just a little hazy. I mean, it was so fast, I didn't feel anything. The only part about it, and I'm glad today that we don't have smell-o-vision. Yesterday, I wanted us to have smell-o-vision. When I was at Aveda today, no, because you can smell the laser in the eye. And I asked Phil, our photographer, I said, Phil, can you smell my eyeball? And he said, yes.
And I'll vouch for that. It was a little different. Wasn't expecting that. But Dr. Lobanoff, how did she do? Because she didn't flinch, she didn't move. I was impressed.
She was a perfect patient. She focused right on the tracking beam. It was what we expect for patients to do. The flaps were perfect. The treatment's in great position. You're going to do great. She was a superstar patient.
All right, there you go, superstar patient. And how long until she's actually going to see great? Because she said it could be still a little blurry right now.
Right, so what she's experiencing right now, she can see across the room. She can read the clock on the wall that she couldn't read when she first walked in.
Okay.
But the vision's going to be a little hazier, foggy right now, as if we filled the room with a mist.
Right.
By tonight, the mist will be gone. By tomorrow, very clear, crisp vision.
All right, well, fantastic. And we have a lot of viewers that actually have questions about this. They're so interested in this. And Deborah from Anoka is one of our first questions. She says, if you already had cataract surgery, can you still have other surgeries to correct vision issues?
And you absolutely can. So patients who've undergone cataract surgery, sometimes the result isn't where they want it to be. We can do LASIK after cataract surgery to free them from glasses. So yes, those patients can have LASIK.
Excellent. And then also Peggy from Farmington, she wants to know that she had LASIK surgery about 6 or 7 years ago to correct nearsightedness. Now she says she needs help reading with reading glasses. And can this be corrected without affecting her ability to see far away?
Yes. So we can go back in. Patients who've been corrected so they can see well in the distance, we can go back in and correct it so they can both read and see in the distance. We call this monovision.
And is that something that you get a lot of questions about?
Yeah. A tremendous amount of questions.
Quite a bit.
Yeah.
Quite a bit.
A lot of people think they can't get out of their bifocals or reading glasses, and they actually can.
Okay, Elizabeth, what was it that you couldn't see the most of? Were you nearsighted or?
Yeah, I couldn't see far away. Okay. So what does that mean? Nearsighted. Okay, yeah, I couldn't see far away. So that was the problem. But hopefully now it's going to be a lot better. I'm kind of ready for a nap.
I bet she is ready. She's been a good sport this whole time. And before we go, Terry from Savage had a question about, she has diabetes, and she wants to know if LASIK is an option for her.
It is. As long as the diabetes is under relatively good control, patients can successfully have LASIK. They do very well. If a patient has diabetes that's not controlled, we ask that they try to get that fixed first.
Okay, fantastic. Well, we are proud of you, Elizabeth, and thank you, Dr. Lobanoff, for taking care of Elizabeth for us. So we can't wait to hear how she's doing yesterday. And Elizabeth, anything you want to say for tomorrow or what you're expecting? Are you excited about going in with all the lights and seeing things clearly?
I'm excited. Yeah, tomorrow you'll see me on Twin Cities Live, and I will be able to see you with no contacts, no glasses. Coworkers, I will no longer be complaining about wearing my glasses. So, and I might stick with this hairnet look. We'll see.
I like it. I didn't get the look. Apparently, I wasn't part of the cool crowd.
She seems to be in a very good mood right about now. Is that she's still pretty happy with what's going on in her world?
Yeah, there's been a lot of giggling going on, and she says, oh, no, I'm fine. But if you know Elizabeth, she's been having a good time, and she's been an excellent sport. So I'm very excited. And she's also, by the way, going to donate her glasses, which is great. So somebody will get very good use out of those glasses she was excited to get rid of, right? All
That's
right.
good. Thank you so much, Emily.
Well, let's test it. How many fingers am I holding up, Elizabeth? How many fingers?
How many fingers you're holding up? 10.
Oh, jeez.
Yes, you are correct.
Back into the night, Doc.
That's amazing work.
Give her another jolt.
I'm afraid she's going to see what I actually look like now in the morning at the gym.
I told her this morning, I said, I get a lot better looking with that 20/20, you know? Hey, all right, if you have additional questions for the doc, You can, or about North Suburban, too, you can check out our live LASIK page we have on our website. Now, how do you get paid to drive a car for a few minutes? Well, we're going to